International Wellness Day 2026. Health is a state of complete physical, mental, and social well-being, and not merely the absence of disease. World Health Organization. Health is often defined by what we lack, the absence of disease or the silence of pain. But the United Nations is championing a far bolder vision. Wellness is not a void, it is a presence. It is a state of physical, mental, and social vitality that empowers every human being to realize their full potential. Maintaining wellness through preventive, lifestyle-based, and people-centered approaches plays a vital role in saving lives, reducing healthcare costs, and delivering cost-effective solutions to preventable diseases. Such approaches strengthen public health systems and contribute to achieving health for all worldwide. In fact, according to the World Health Organization, non-communicable diseases account for nearly 74% of all global deaths, many of which are preventable through healthier lifestyles. This clearly shows that the future of healthcare lies not only in treatment, but in prevention. For decades, global healthcare has been reactive, a system designed to fix what is already broken. However, the true path to health for all lies in shifting toward prevention, awareness, and sustainable living. Recognizing the value and diversity of cultures, the United Nations highlights the importance of traditional knowledge systems. The practices of indigenous peoples and local communities are not relics of the past. They are pillars for the future. When evidence-based traditional medicine is combined with modern clinical approaches, it creates an inclusive and holistic foundation for global health. This synthesis respects cultural diversity while enhancing well-being in a rapidly changing world. To promote awareness and action, the United Nations General Assembly officially proclaimed April 15th as International Wellness Day, recognizing that global health must move beyond treatment to prevention. This day serves as a powerful platform for education, cultural exchange, and knowledge sharing. It encourages people everywhere to embrace accessible, inclusive, and affordable wellness practices that enhance both personal and collective health. It also builds on other global observances, such as International Day of Happiness on 20th March, International Day of Yoga on 21st June, and World Meditation Day on 21st December. Together, these initiatives reinforce a shared global vision of harmony, balance, and holistic well-being. At the heart of the 2030 Agenda lies the Sustainable Development Goals, particularly Goal 3, Good Health and Well-Being. This goal aims to ensure healthy lives for all at all ages by addressing maternal and child health, communicable and non-communicable diseases, access to essential medicines and vaccines, and universal health coverage. It also highlights an often overlooked truth: mental health is fundamental to overall well-being. Mental health is not merely the absence of mental illness. It's really about the ability to cope with stress, realize one's potential, work productively, and contribute meaningfully to society. Yet, despite growing awareness, challenges remain. According to the World Health Organization, depression and anxiety cost the global economy nearly $1 trillion annually in lost productivity. This reflects not only a health crisis, but also a socio-economic challenge. Mental health, therefore, is not just a personal issue, it is a public priority and a basic human right. The wellness sector today plays a crucial role in achieving sustainable development. It contributes to job creation, poverty reduction, and inclusive economic growth. More importantly, it empowers individuals and communities to adopt sustainable lifestyles and safeguard resources for future generations. Great strides have been made in improving global health. However, inequalities in healthcare access still persist. Millions of people around the world continue to lack access to basic health services, safe medicines, and preventive care. The Sustainable Development Goals set an ambitious target to end epidemics such as AIDS, tuberculosis, and malaria by 2030, and to achieve universal health coverage for all. But achieving this vision requires more than policy. It requires collective action. As we move forward, our mission is clear: to bridge the gaps in healthcare access, to integrate traditional wisdom with modern science, and to ensure that wellness is not a privilege, but a universal right. Because in the end, the real question is not whether we understand health, but whether we are willing to live it. Wellness is not something we wait for. It is something we build every single day. And a developed world is one where every individual has the opportunity not just to live longer, but to live better.